Mindful parenting. In order to discuss uses for mindfulness meditation in parenting within traditional attachment theory and Buddhist non-attachment contexts, we will examine: what is attachment theory? What is non-attachment? How do these theories relate? How can we use mindfulness mediation in parenting? And what is mindful parenting? Attachment theory was pioneered by John Bowlby and Mary Ainsworth, and it concerned the quality of the child-caregiver relationship. In this context, the term attachment refers to an innate desire to form an affectional tie with one or more caregivers. Since young children cannot live without the help of a caregiver, virtually all children are attached to a small number of caregivers. However, in a severe case of maternal deprivation such as orphans and institutions of poor quality, it is possible that a child be attached to absolutely nobody. Such a child would initially protest, then despair, and eventually become completely detached, or non-attached. Attachment theory is not about attachment versus non-attachment. It focuses on the pattern of attachment which can be identified by a simple laboratory test created by Mary Ainsworth called the strange situation for infants at the age of 1. Attachment is classified into two attachment patterns, organized and disorganized. If a parent is threatening or abusing, the child would develop fear of their parent while they are still attached to the parent. This leads to disorganized attachment because the same parent is the source of threat and comfort at the same time. Organized attachment is further classified as secure or insecure. An infant with secure attachment would resist and cry when they are separated from their parent but will return to being happy after reunion. Their parent responds to his or her physical and emotional needs in a timely manner, at an appropriate level, and with consistency. Insecure attachment can be classified into two attachment patterns: avoidant and ambivalent. An infant with avoidant attachment would almost ignore their parent upon departure and return. Their parent would be ignoring, rejecting, and/or controlling. An infant with ambivalent attachment would be clingy and angry at his or her parent. Their parent would be inconsistent. Although the above patterns are described for 1-year-olds, these qualities tend to persist throughout their lives. There is another test called the Adult Attachment Interview, AAI, which was developed by Mary Main. The AAI can often identify the attachment pattern of an adult corresponding to their infant attachment pattern. Parents of a certain attachment pattern, identified by AAI, tend to raise their own children with the same attachment pattern. People with secure attachment are more resilient when the attachment figure is no longer available, for example, due to death. People with secure attachment internalize and carry their virtual attachment figures with them for the rest of their lives. On the other hand, people with insecure attachment tend to have more difficulty as the grief would linger on. While people with ambivalent attachment are often excessively emotional, those with avoidant attachment would try to contain and ignore their emotions beyond a reasonable level. As professionals, we can say that secure attachment is a desirable state of mind for both children and adults. In contrast, disorganized attachment would be considered pathological and it would be very difficult for the child to develop normally afterwards. One of the most important topic in Buddhism is about suffering, translated from a Pali word dukkha. Unfortunately, there always is a problem with translation, and the terms used in Buddhist teachings are no exception. The meaning of dukkha is actually broader than suffering, also covering pain, sorrow, misery, dissatisfaction, as well as all sorts of issues associated with materials, sensations, relationships, ideas, etc. Thus, it is essential that when we use the word suffering in this essay, we actually refer to the meaning associated with the original word dukkha. Now, if we have to choose one main goal of Buddhism, it must be the end of suffering. Buddhists view that suffering is caused by craving for or thirst, tanha, of, as well as clinging or attachment, upadana, to a variety of things, including materials, sensations, ideas, etc. The distinction between craving and clinging, attachment is subtle. Craving is when a desire gets excessive, clinging is when one cannot let go of the desire. In Buddhism, craving is said to cause clinging. Then, craving is viewed as conditioned in our minds and evoked automatically. This is the source of suffering. However, Buddhists teach that suffering can end when craving disappears, leading to a state of enlightenment. They also teach the path to the end of suffering, a collection of practical advice including types of daily activities and meditation. This is the main point of Buddhism, called the Four Noble Truths. 1. The nature of suffering. 2. The cause of suffering. 3. The end of suffering. 4. The path leading to the end of suffering. Although the term attachment in Buddhism most directly refers to clinging, upadana, it is closely associated to craving, tanha. Thus, when we discuss the end of suffering through eliminating craving and thus clinging, we often use the term non-attachment or detachment. One might have heard that Buddhism discourages all sorts of desires. However, this is misleading. Desire and craving, for the desire, should be distinguished. A desire is all right as long as we recognize it and still do not crave for it. Then, we could deal with desires wisely. In fact, it would be very unhealthy to suppress desires. An example would be this version of the monkey trap story. A monkey sees a banana behind a glass window of a store, where there is a hole large enough for his hand to go through. Craving for it, the monkey reaches the banana through the hole. But once he grasps the banana, his fist is too large to pull out of the hole. Although the monkey can certainly let go of the banana, he would not do it and is thus trapped with the banana. If the monkey recognizes the desire for the banana but does not develop craving or clinging, he does not need to be trapped. Even non-Buddhists can see that craving is problematic, especially when they observe greed and obsession as craving for materials and other forms of possession. However, it is entirely another story to be able to eliminate craving. For this, Buddhists have been using mindfulness meditation, also called insight meditation. Note that Buddhists practice, in addition to mindfulness meditation, concentration meditation, which is also found in other traditions. While mindfulness meditation has also been used by non-Buddhists, Buddhism has the longest recorded history of integrating it within their philosophy/psychology/practice. Since mindfulness meditation itself is not at all religious and can be practiced by anybody, it has been adopted by physicians, psychiatrists, psychologists, educators, etc. with positive effects. People often misunderstand the Buddhist use of non-attachment and mistake that Buddhism is anti-relationships, anti-passion, and/or anti-love. Quite the contrary. For example, Buddhism is clearly for loving kindness, metta, and compassion, karuna, and not denouncing relationships. However, loving kindness pursued by Buddhists is considered unconditional love and not the kind of love based on sensual pleasure. Love in an ordinary sense, especially coupled with sensual pleasure, can be conditional. That is, one might love only when he feels good or is loved by someone else. This type of love is not loving kindness and not positively viewed in Buddhism because the mental state is conditioned by craving for a certain state expected by the person. It will lead to suffering. Unconditional love is different and is sometimes associated with the kind of love offered by a mother to her child. However, this description can still be misleading, because according to attachment theory, mothers exhibit different types of behaviors with their children. For example, mothers who are themselves insecurely attached tend to behave more selfishly than those who are securely attached. Real unconditional love taught by Buddhists must be devoid of all conditioned behaviors and mental states, including controlling through punishments and rewards. By now, it must be clear that we need to use the terms attachment and non-attachment carefully. When we use their word attachment in connection to attachment theory, we generally refer to secure attachment as a more desirable state than insecure attachment. When a person is securely attached, she has a more accurate, objective, and positive view of her parents or caregivers but does not cling to them, even when they are not physically available. It is not the contrast between attachment and non-attachment, since virtually every child is attached to some caregiver. With respect to attachment theory, there is no need to use the term non-attachment. On the other hand, the word attachment based on Buddhist teachings, is associated with the idea of craving for materials, relationships, ideas, etc. In this sense, non-attachment, the absence of craving, is a desirable state. But it certainly is not the same thing as not loving. To refer to this point, we henceforth use the term non-craving instead of non-attachment. Although the term detachment is being used synonymously with non-attachment in this context, it seems misleading because non-craving promotes neither forceful detachment from someone, something nor a state of separation. First, as described earlier, people with secure attachment are able to cope with bereavement better than those with insecure attachment. This is because the former do not cling to dead people as much as the latter. More generally, people with secure attachment tend to develop better relationships later in life, mainly because they can interact with people more naturally depending on each situation and do not cling to their own expectations. People with secure attachment also tend to have their children securely attached to them for the same reason. Thus, the entire situation appears close to the notion of non-craving in Buddhism. That is, in connection to both attachment theory and Buddhism, non-craving would lead to well-being. Second, a new kind of connection between attachment theory and Buddhism has been evolving thanks to the recent development in neuroscience. For example, the same areas of the brain, including the middle prefrontal cortex, has been shown to be activated and even strengthened in both people with secure attachment and experienced mindfulness meditators. In this connection, Siegel proposes that internal attunement is the key to both secure attachment and mindfulness. This suggests that secure attachment and non-craving through mindfulness share certain brain functions. Although this is just one aspect, future research may discover more along the same line. So, secure attachment in attachment theory and non-craving in Buddhism seem to be consistent. As long as the terms are used carefully, we can avoid the confusion of premature and incorrect conclusion that the use of the term attachment is contradictory between attachment theory and Buddhist teachings. It is possible to consider secure attachment as the middle way as discussed in Buddhist teachings. While people with avoidant attachment tend to minimize the emotional reaction to distress, people with ambivalent attachment tend to crave for and maximize. The former suppress their desire to be with and the latter literally cling to their attachment figures. In between these extremes, people with secure attachment tend to respond naturally and appropriately to emotional distress, without overreaction. Second, one of the three characteristics of existence in Buddhism, along with suffering, is impermanence, anicca, that is, the idea that whatever rises will fall. People with secure attachment appear to embody the principle of impermanence. In a sense, contrary to the label secure attachment, they seem to know that nothing is secure. Secure attachment may actually be the ability to recognize insecurity and let it go. Furthermore, people with secure attachment can deal with relationships more naturally than those with insecure attachment. This is because they perceive relationships, which are indeed impermanent, more objectively. On the other hand, people with insecure attachment would react differently. For example, people with ambivalent attachment would cling to people, things as if they were available permanently. People with avoidant attachment would suppress their desire for people, things as if they were permanently unavailable. The following quote from Goldstein and Cornfield, 1987, seems to refer to both impermanence in Buddhism and secure attachment in attachment theory. Things are insecure or unsatisfactory in the sense that something that is always changing is incapable of giving us a lasting sense of completion or fulfillment. When we see this deeply in ourselves, It also begins to decondition the strong forces of desire and grasping in the mind. We begin to let go, allowing for the inevitable flow of change, rather than trying to hold on to something, thinking that it will make us happy forever after. Next, there is a tricky aspect regarding mother love. While mother love is often considered as an example of unconditional love, it can also be seen as an example of selfish love because a mother may protect her own child at the cost of other children or people. In the latter view, mother love is actually seen as craving, not a wholesome position in Buddhism. One way Buddhist stories reconcile the above situation is through generalization of particular mother love to universal unconditional love, although such an idea is not explicit in the original Buddhist writing. An analogous idea has been proposed in attachment theory as can be seen in the following passage. Gilarth and Shaver, 2005. Attachment theory suggests that the same caregiving behavioral system that evolved to assure adequate care for vulnerable, dependent children can be extended to include care and concern for other people in need, perhaps even compassion for all suffering creatures, an important Buddhist ideal. Research clearly indicates that the condition of the attachment behavioral system affects the workings of the caregiving system, making it likely that heightening attachment security will yield benefits in the realm of compassionate caregiving. This type of generalization is also commonly seen in the practice of loving-kindness meditation in Buddhism as well as in some approaches in psychotherapy. Furthermore, some researchers even suspect the connection between secure attachment and balanced, wholesome mind as discussed in Buddhism. Attachment theory helps to explain why insecure people are less compassionate and kind than secure people. Caregiving, an innate behavioral system, is undermined by attachment insecurity. In a sense, people with insecure attachment are more preoccupied with self. Now, one might think of the contrasting notions of self in modern disciplines like psychotherapy, and not self, anatta, in Buddhism. Not self is one of the three characteristics of existence in Buddhism, along with suffering and impermanence. Buddhism actually does not deny self-consciousness. It rather posits that there is no continuous, permanent entity associated with each individual, also reflecting the notion of impermanence. In a sense, the Buddhist position is not that different from that of recent developments in science. The idea turns out to be supported by some attachment researchers, who argue that continuous self is an illusion and self is a collection of attitudes, expectations, meanings, and feelings. According to that hypothesis, roads to well-being must be open-minded. Both attachment theory and Buddhist teachings seem to satisfy this condition. The development of attachment theory demonstrates how rigorously the ideas in the field have been examined by the research community and have been surviving various criticisms. Buddhists are notorious about their open-mindedness. For example, the current Dalai Lama of Tibet stated in 2005 that if scientific analysis were conclusively to demonstrate certain claims in Buddhism to be false, then we must accept the findings of science and abandon those claims. He is well known for his effort to host and/or attend to conferences integrating Buddhism and science. For example, he accepts that some of ancient Buddhist notions of physics and astronomy need to be revised, reflecting the modern discovery. However, much of Buddhist teachings have been supported in recent findings in science. Although the Dalai Lama is probably the best known on this point, the Buddha himself had repeatedly urged his followers to experiment and verify his words for themselves. It is amazing to see this kind of openness, while some other religions fight against, say, science to the death. At the intersection of attachment theory and Buddhist teachings lies the topic of parenting. In particular, we discuss the possibility of promoting secure attachment through the practice of mindfulness. This question has been asked by Shaver and discussed in some detail by Siegel. The idea is that even parents with insecure attachment could raise children who would be securely attached to them, through the practice of mindfulness meditation or just trying to be mindful in everyday life. First, we recall that attachment patterns can be identified when infants are 1 year old. That is, by this time, children already develop their patterns, obviously unconsciously, and tend to carry the traits for the rest of their lives. However, it has been shown that some children with insecure attachment grow to be classified as secure, using the adult attachment interview. Although some researchers argue that even an adult with insecure attachment can earn secure attachment by way of psychotherapy and possibly with an empathic partner, it seems the best way to overcome attachment insecurity would be mindfulness meditation. And we will come back to this point later. Second, although secure attachment may be a gateway to mindfulness, the former does not guarantee the latter. Suppose that a child is securely attached at the age of 1. Even if that is the basis, the child will go through all sorts of experience before becoming a parent. As attachment patterns are in principle fixed by the age of 1, it is more emotional and certainly unconscious. However, much of the experience which a child goes through after the first few years is more cognitive and conscious. The child will be affected by cognitive and conscious efforts of her parents as well as many other factors in the larger context. When parents provide unconditional love as described in Unconditional Parenting by Alfie Kohn, their children are equipped with the strongest foundation for mindfulness as well as secure attachment. If a child with secure attachment goes through conditional parenting, such as through punishments and rewards, she would still remain securely attached and would raise children with secure attachment. However, she would develop a mind which is so much conditioned at the cognitive level, and such a mind would not lead to mindfulness. So, mindfulness is much more than secure attachment. Now, why then mindfulness meditation might work as a training for parents who are insecurely attached and/or conditional? Because mindfulness meditation can lead a person to clearly see what is behind one's mind, including unconscious aspects, while she continues to live her usual life. Note that concentration meditation will not have the same effects. In a sense, it would let the meditator escape from the reality. Unlike suppressing or repressing one's desires or trying to control one's behavior in a forceful manner, the state of understanding gained through mindfulness meditation would let her see how her senses lead to craving and clinging and open a way to stop reacting in such a conditioned manner. It is more about listening. It is not intended to control or change one's behavior through the practice, although there would be changes as a result. Since mindfulness meditation could work at all levels of the mind at all time, even unconsciously engraved part of emotion could be affected. Thus, realizing and being able to see all the conditioning behind insecure attachment could enable one to overcome insecure attachment without trying to earn secure attachment. The knowledge of attachment theory would also be helpful, because when one develops mindfulness, she would be able to see it in connection to the ideas developed in attachment theory and thus would be able to communicate with others more effectively. Although psychotherapy shares many aspects with mindfulness meditation, including access to unconsciousness, there are some potential limitations of psychotherapy without integrating mindfulness training. The most essential point of mindfulness training is that one can gain the ability to see things clearly continuously. In contrast, psychotherapy can focus too much on therapy sessions and may not have enough means to monitor patients out of therapy. A similar point can be said about most of modern approaches in medicine, dentistry, etc. For example, the most essential aspect of periodontal maintenance is home care. Nevertheless, most periodontists lack the means of actually monitoring their patients' daily home care. It is entirely up to the patients, most of who are not properly educated on this point and tend to believe that visiting a periodontist every few months would be sufficient. Without proper home care, routine care and even surgery would be ineffective. If a patient is mindful with respect to their periodontal or any other health conditions, she could see what is going on in her body and mind, and could take better care of herself. Recently, mindfulness meditation is adopted or integrated into psychotherapy, stress reduction, education, and many other areas. This clearly suggests the benefit of mindfulness meditation, Even people with secure attachment can develop a conditional parenting style, such as using punishments and rewards. This kind of conditioning too is hard to remove. Mindfulness meditation would be useful to realize how such conditioning is at work, and the recognition alone may lead to marked improvement. People with secure attachment may not be able to understand how people with insecure attachment feel and act. With mindfulness, people with secure attachment could better understand how people with different attachment patterns behave. Finally, people with disorganized attachment will most likely benefit from professional treatment, including psychotherapy. They need to address unresolved issues. Even in this case, therapeutic approach seem to have certain similarities with Buddhist teachings. In any case, it would be beneficial to recognize one's own attachment pattern. Then, we can proceed with appropriate paths, possibly with the help of mindfulness meditation.